So how does thyroid hormone and testosterone affect one another? Let's talk about it. All hormones are interconnected, including thyroid hormone and testosterone. Testosterone has been shown to affect thyroid hormone production and function. Studies show that exogenous testosterone, that means testosterone replacement therapy, changes thyroid hormone production, especially in autoimmune thyroiditis. Exogenous testosterone may have a protective effect on the thyroid, particularly against autoimmunity. We also know that thyroid hormones directly impact the metabolism of sex hormones, including testosterone. Hormone function changes, either increased or decreased, can disrupt optimal testosterone levels. Hypothyroidism or underactive thyroid is associated with lower testosterone production. Effect on thyroid hormone by testosterone has been studied in trans men. When given exogenous testosterone to trans men, their thyroid actually increases in size. It's been postulated that male metabolism, being more active than female metabolism, requires a larger thyroid gland, and thus testosterone increases in puberty, also increases the thyroid volume and its hormone production. Optimizing hypothalamus function is critical if you're considering testosterone replacement therapy. First, to minimize effects on the glands, including the thyroid, and to improve testosterone metabolism. My patients who use Genesis Gold daily can use less testosterone and have more hormone production. If you have any questions about testosterone and thyroid function, please join us in our free Hormone Reboot Training. I'll see you in the next video.